Welcome to the Piedmont of Augusta Total Hip Replacement Education presentation. My name is Megan Doman, and I am one of the orthopedic nurse navigators. Thank you for joining me as you prepare for hip replacement. This presentation will educate you and your family on your upcoming hip replacement and recovery. We will be covering many topics during this video, which include joint anatomy, pre-op, surgery, post-op, physical therapy, discharge plans, medical equipment, and physical therapy. The hip is a ball and socket joint in which one part, the ball, moves in the other, the socket. This type of joint allows for movement in every direction. During a hip replacement, the arthritic or injured ball and socket are removed and replaced with a new femoral component, femoral head, plastic liner, and acetabular component. There are several ways you will know it's time for hip replacement. You have trouble getting out of a chair, walking upstairs, or standing up from the toilet. Trouble sleeping due to pain, your pain medication no longer relieves discomfort, joint pain or immobility prevents you from completing everyday tasks, regular outings to visit friends, shopping, or vacations. The benefits of hip replacement include pain relief, increased mobility and muscle strength, maintaining personal independence, and returning to hobbies. When planning for surgery, there are several adjustments you may need to make to your home to ensure safety. Considering placing night lights in your hallways, bedroom, and bathrooms for safety at night. Most home accidents happen in the bathroom. Purchasing a non-slip bath mat for your tub or shower will decrease your risk of falling. Try to place kitchen and bathroom items at or around waist level for easy access after surgery. Clear out any objects in hallways or walkways to allow for safe movement from room to room. Remove throw rugs or loose carpeting that could cause you to trip or fall. Arrange for someone to bring you to and from the hospital. You will not be able to drive until your surgeon allows you to do so, and you are off narcotic pain medications. Before surgery, be sure to set up transportation to your appointments and physical therapy. If you live alone, reach out to family or friends to check in with you for the first week post-op. If able, have someone stay with you for the first 3 to 5 days after surgery. A responsible adult should remain with you for at least the first 24 hours after discharge from the hospital. Run any necessary errands prior to surgery. Stock up on essential household items and foods. Prep and freeze your favorite dishes or designate a friend or family member to assist with meals. When packing for the hospital, be sure to bring comfortable clothes that are easy to take on and off. Items with some stretch or elastic are helpful after surgery. Bring an up-to-date medication list for the nurse to review, but you do not need to bring your medications with you on the day of surgery. Bring your rolling walker for use with physical therapy. Please leave all money and valuables at home, but be sure to bring your insurance, Medicare or Medicaid cards, blood donation card, any paperwork from your surgeon's office, and advance directives. In preparation for surgery, you will want to make sure you are eating well. A healthy pre-surgery diet consists of lean meats and proteins, fruits and vegetables, as well as whole grains. Drink 6 to 8 glasses of water daily to stay hydrated, unless you are on a fluid restriction. Limiting the amount of fat and sugar you eat before surgery can positively impact your healing and stabilize your blood sugar. Patients who have diabetes can benefit from tracking and controlling their blood sugar prior to surgery, as well as eating a balanced diet. The main equipment you will need after hip replacement is a rolling walker. This is a walker with wheels in the front and slides or tennis balls in the back. This walker allows you to stand upright, provide support, and easy mobility. If you do not have a rolling walker, the orthopedic office has a vendor who can run your insurance and fit it for you during your pre-op appointment. Please let them know at this appointment that you need a rolling walker. A toilet riser may be helpful if you have a lower toilet or already struggle to stand from your commode. This riser adds 3 to 5 inches to the toilet, and some even have handles to assist with standing. A shower seat can be used in either a tub or a walk-in shower. The seat gives you a place to sit if you feel fatigued during bathing or cannot tolerate standing during a shower. Keep in mind that equipment coverage is based on your insurance plan and benefits. Please call the number on the back of your insurance card if you have questions regarding your equipment benefits. Before surgery, you will need to be seen by your primary care physician. This may include a physical exam, review of current and past medical history, and current medications. If you have a history of heart issues, you will have to be cleared by your cardiologist. They may order additional tests to make sure your heart is ready for surgery. Your dentist will have to sign off on your oral health. Please see your dental hygienist for your annual cleaning before surgery and have any necessary procedures. The primary care physician, cardiologist, and dentist will send their clearances to the surgeon's office. Next, you will see the orthopedic surgeon or their assistant prior to surgery. They will review knee replacement surgery, recovery time, physical therapy, equipment needs, and answer any questions. After your appointment with the surgeon, you'll be sent to the Piedmont Augusta Outpatient Center to have your pre-admit testing done. This is the Piedmont Augusta Outpatient Center. If you are facing the main hospital, it is located directly to the right and has its own parking lot. You will enter the building and go to the second floor to register. Pre-operative testing is performed to ensure you are in favorable health at the time of your surgery. Please bring a copy of your most up-to-date medications. This should include the medication name, dose, and how often you take it. If you have had any recent vaccinations, please bring a copy of those records. Lastly, bring a copy of your advance directives, which include a living will or medical power of attorney. Your past medical and surgical history will be reviewed, as well as your home medications. You may have blood work, EKG, or chest x-ray done at this visit, if ordered by your surgeon. A pre-op MRSA nasal swab will be performed. MRSA is an antibiotic-resistant bacteria that can be carried by an individual unknowingly and not even cause illness. However, prior to surgery, patients are tested, and if positive, they are given mupirocin ointment to reduce the number of bacteria in their nose. If your nasal swab comes back positive, the ointment will be called into your pharmacy. Follow the instructions on your prescription. You'll be given and instructed how to use a set of chlorhexidine wipes. They are used after bathing the night before surgery to help remove bacteria from your skin. Diabetic patients receive 2 Ensure pre-surgery clear carbohydrate drinks. These supplements help stabilize blood sugar while unable to eat during surgery. Drink 1 bottle the night before surgery. Drink the other bottle within 5 to 10 minutes up to 2.5 hours before your scheduled surgery time. The night before surgery, you will shower and then use the chlorhexidine wipes according to the hospital instructions. Wear clean pajamas and sleep on clean sheets. Do not shave or remove hair from any part of your body except your face. Do not smoke or drink alcohol 24 hours before surgery. Your anesthesiologist may call you. Follow any instructions he or she provides. Do not eat any solid food for 8 hours prior to your surgery. This includes mints, gum, and candy. Do not drink any clear liquids 4 hours prior to your surgery. This includes ice or water. The only exception is for patients who receive Ensure Clear Carbohydrate supplements. Ensure Clear Carbohydrate supplements are given to diabetic patients to stabilize blood sugar while in the operating room. Examples of clear liquids include water, pulp-free fruit juices, fruit punch or fruit drinks, hot or cold coffee or tea without milk or creamer, sodas, sports drinks, clear broth, plain or unflavored gelatin without added fruit or toppings, frozen juice bars, and of course the Ensure Clear Carbohydrate drinks. On the morning of surgery, you may bathe or shower. Do not apply lotion, deodorant, or powders. Wear clean, loose, comfortable clothes that are easy to take on and off. For your safety and infection prevention, do not wear makeup, nail polish, acrylic nails, jewelry, hairpins, or perfumes. Bring a storage case for your glasses, contact lenses, or hearing aids. Do not eat anything the morning of surgery. You can drink clear liquids up to 4 hours before surgery. If instructed to do so, take your Ensure pre-surgery clear carbohydrate supplement. Only take medications if you are told to do so at your pre-op or instructed by your anesthesiologist. On the day of surgery, you will report to the Surgery Care Center. It is located on the second floor of the main hospital. The Surgery Care Center will be on your left across from the second floor waiting room. You are allowed 2 family members or support persons to come with you into the Surgery Care Center. There is no food or beverage allowed in the SCC. Please note that our visitor policy is subject to change. As you check into the Surgery Care Center, your identity and procedure will be verified and a patient identification armband will be placed on your wrist. Once a nurse calls you, they will verify your identity and ask what procedure you are having. You will be brought to a private Surgery Care Center room. Next, the nurse or patient care assistant will give you another set of chlorhexidine wipes and have you wipe down in the same manner you did the night before. You will also empty your bladder in the bathroom. You will then put on a hospital gown, non-skid socks, and a surgical hairnet. You will need to remove dentures, hearing aids, contacts, and jewelry. An IV will be started by the nurse and blood work may be drawn. If the surgeon has ordered any medications for you to take before surgery, they will be given at this time. Generally, total joint replacements receive a pain cocktail before surgery to help cut down on post-operative pain. The orthopedic nurse navigator guides you through the surgical process from beginning to end. They provide pre-op education, set up PT appointments, assess equipment needs, and give discharge teaching. As part of your pre-op teaching, the orthopedic nurse navigator will instruct you on use of an incentive spirometer and ankle pumps. An incentive spirometer helps to prevent pneumonia. This device works by opening your lungs and may cause you to cough. Your nurse will instruct you on how to use it before and after surgery. You will generally use your incentive spirometer 10 times per hour while awake. Ankle pumps help to promote blood flow in the lower legs and help avoid blood clots. They are done by flexing your feet back and forth as if pumping a pedal. You will do ankle pumps 40 times an hour while awake during your recovery. You will be asked to rate your pain before and after pain medications are given. Pain is rated on a scale of 0 to 10, 0 being no pain and 10 being the worst pain. Do not wait through your pain. You will be visited by your surgeon, anesthesiologist, and circulating nurse before going to the OR. The surgeon will review the plan for surgery and mark your surgery site with an O. The circulating nurse will come visit you and will be the nurse by your side during surgery. This nurse will ask for the telephone number of the individual who would like to be contacted by the OR team via text alerts. The anesthesiologist will visit just before you go back to the OR. They will give you a sedative through your IV to relax and calm you before taking you back for surgery, unless you are having spinal anesthesia. There are generally two types of anesthesia for joint replacement: general anesthesia and spinal anesthesia. With general anesthesia, the anesthesiologist will give you a combination of medications through your IV or inhaled gas to put you to sleep. You are fully asleep, relaxed, and unconscious during surgery. Once you are asleep, the anesthesiologist will insert a breathing tube into your mouth and down your windpipe. This tube helps you breathe during surgery. The anesthesia care team will monitor your vital signs and adjust as needed during surgery. With spinal anesthesia, the anesthesiologist gives you medication into your back to numb the lower half of your body and medications to put you in a light sleep. You are in a light sleep, relaxed, and breathing on your own. You will not need a breathing tube, but will be given oxygen during surgery. The anesthesia care team will monitor your vital signs during surgery and adjust as needed. Hip replacement generally takes 1.5 to 2 hours. OR times vary for each patient and surgeon. You will be transferred to the recovery room following surgery. After surgery, you will go to the recovery room for a minimum of 1 hour. You will wear oxygen and an oxygen monitor, have IV fluids, and a blood pressure cuff on your arm. Your recovery room nurse will perform neurological assessments to ensure you have good sensation in your limbs. When your vital signs are stable and your pain is under control, you will be transferred back to the surgery care center. Once you return to the surgery care center, your family member or support person will be able to be with you at bedside. Your vital signs will be monitored and pain managed. You will be given something to drink while resting on and off until you are awake enough to work with physical therapy. Your nurse will contact physical therapy once you are alert and responsive, engaging in questions without falling asleep, and your surgical limb is awake. Your limb is awake when you can lift your limb off the bed and pump your ankle, or if you have been assisted to the bathroom by nursing staff. At that point, you will be ready to participate in therapy. Physical therapy will include assessing your ability to move your surgical limb before standing, your ability to stand on the surgical limb with good control, and then your ability to safely walk in comparison to your prior level of function. Therapy will cover the following topics with you: how to safely get in and out of bed, how to walk with the appropriate device such as a rolling walker. Therapy will assist you in adjusting your rolling walker if needed. You'll be provided with equipment recommendations to ensure safety and help with pain management following discharge, education on use of ice packs and how to manage your pain and swelling, how to walk up and down stairs, discussion of how to get in and out of your vehicle. You will be given home exercises to perform until your first physical therapy outpatient session. Here we see the home exercises you will perform daily. First, you will bend your foot back and forth at the ankle joint. Repeat 40 times every hour with both legs. Next, you will slowly tighten the muscles on the thigh of the surgical leg. Hold for 5 seconds. Repeat 10 times, 4 times daily. Then you will squeeze your buttocks muscles as tightly as possible. Hold for 5 seconds. Repeat 10 times, 3 times a day. Finally, while laying down, you will bend the knee and pull the heel towards the buttocks. Then slowly stretch the leg back out. Repeat 10 times, 3 times a day. After discharge, please remember to walk often to improve mobility and decrease stiffness. We recommend getting up to walk or move at least once every hour during the day. Apply ice to the operated knee for 20 minutes at least 4 times a day to prevent swelling and control pain. Use ice more frequently if desired. Ice is your friend. When navigating stairs or steps, go up with the good and down with the bad. When you are ready to be discharged home, your surgeon will provide your specific discharge instructions. Please keep in mind that the instructions are surgeon and surgery specific. Take your pain medication as prescribed. Do not drive or operate machinery while taking pain medication. You will be able to bear full weight on your hip as tolerated, unless instructed otherwise by your surgeon. When up, use your walker to help with balance and mobility. Activity may cause your leg to swell. Swelling is common and will change daily. It should improve with elevation, ice, and rest. You may sleep on your side or in a recliner if it is more comfortable. Follow the specific wound care instructions provided by your surgeon. Continue your normal diet as before surgery, but add fiber sources such as fruits, vegetables, and whole grains to help with constipation. You will need to add an extra 250 calories to your daily diet to heal your wound. This should include lean meats, fruits, and vegetables. Drink 6 to 8 glasses of water per day, except if you are on a fluid restriction. Keep in mind that most patients are discharged home on the same day as surgery. However, if you are admitted overnight, you will receive more education about your hospital stay during your admission. Preventing post-op constipation is very important for your recovery. Drink 6 to 8 glasses of water every day unless you are on a fluid restriction. Get up and walk around every hour to keep your bowels moving. Add fiber to your diet with fruits, vegetables, and whole grains. If necessary, you can add an over-the-counter stool softener or laxative to help with a bowel movement. Walking immediately after a meal promotes good digestion and can help prevent constipation. A surgery site infection is an infection that occurs after surgery in the patient's body where the surgery took place. Most patients who have surgery don't develop an infection. However, infections develop in 1 to 3 out of every 100 patients who have surgery. If you have any signs or symptoms of infection such as redness, pain, fever, or drainage, call your doctor immediately. After each shower, completely dry the skin with a fresh, clean, dry towel. Do not use lotions, powders, deodorants, or deodorant spray near your incisional site. Do not allow pets to lie on or near your surgical site, even if it is covered with a dressing. Keep all pets away from the incisional site until healed. Pets carry bacteria on them that might cause infection in your surgical wound. Do not take the dressing off until you are told to do so, unless it gets wet or soiled. You may have small, white strips of bandage covering your wound underneath a larger dressing. These strips are known as steri-strips. They are used to help a wound stay closed as it heals. Do not peel these strips off. They will fall off on their own. Do not take a shower until your surgeon tells you to do so. Hand hygiene is extremely important after surgery. First, you will wet your hands with warm running water. Put enough soap in the palm of your hands to get a lot of bubbles. Wash your hands by rubbing them together for at least 20 seconds. Do not forget to wash between your fingers and under your fingernails. Rinse your hands with running water. Dry your hands with a paper towel and then use the towel to turn off the faucet. If you do not have access to soap and water to clean your hands, use an alcohol-based hand gel or foam. It is important to wash your hands before and after meals, after a sneeze, after going to the bathroom, before and after surgical dressing changes, after touching pets. Ask your family and friends to wash their hands when they are near you. If you do not see them clean their hands, ask them to do so. Here are a few helpful hygiene hints. It is important to keep your surgical area clean and dry to prevent bacteria from growing and causing infection. Avoid touching your incision area and follow all instructions from your surgeon on how to take care of your incision. Do not scratch or pick at scabs. Scabs help to protect your wound, and removing them exposes your wound to germs. If you have sutures or staples closing your wound, you need to go to your physician's office to have these removed. Never remove them yourself. Before and after taking care of your incision area, wash your hands or use an alcohol-based sanitizer, and have any family members helping do the same. Maintain a clean environment. Keep clean sheets on your bed and make sure the clothes that come in contact with your incision are clean. This provides a safer environment for your body and surgical area by removing the old dead skin and bacteria that accumulates at night. Here is an example of a post-op hip replacement infection. Post-op infections often become so severe that the site can open and have large amount of drainage. These infections may require long-term antibiotics or a secondary surgery. Call your doctor if you have a temperature greater than 101.5 for at least 12 hours. Persistent nausea or vomiting, numbness or tingling in your leg, severe uncontrolled pain that is not relieved by your pain medication, redness, tenderness, or signs of infection at your incisional site, hives, persistent dizziness or lightheadedness. If you have chest pain or shortness of breath, please call 911 immediately. As this presentation ends, I would like to recap a few things. Try not to get frustrated with yourself. Everyone heals in their own time. Be sure to move every day, but pace yourself. Take time to rest, and do not try to start back to household chores until you are healed. Eat a well-balanced diet. We want you to add an extra 250 calories a day to heal your incision. Drink 6 to 8 glasses of water every day unless on a fluid restriction. Get plenty of rest, but keep in mind your sleep habits may change during your recovery. Also, remember, no procedures for the first 3 months following surgery unless they are emergent. MyChart allows you to access a portion of your medical chart. You can see your medications, test results, upcoming appointments, medical bills, and much more, all in one place. You can quickly schedule, change, or cancel appointments. MyChart allows you to connect with your doctor or their nurse by sending them a secure message. Medical bills can be paid online through MyChart. You can use MyChart on any computer using the website, or on a tablet or smartphone through the app. The MyChart app can be downloaded through the App Store on an Apple device or the Google Play Store on an Android. If you are already signed up for MyChart, click here to visit the website. If you are not signed up for MyChart, click here to visit the registration website. Fill out the required information. Please include either an email or mobile phone number. Once you submit the form, you will receive an activation code as an email or text message. Click the next link to complete your registration. Once you are registered, you will be able to access your MyChart. If you need to recover your username, click here. Resetting your password requires your username, so you may have to recover your username to reset your password. As part of your surgical prep, the orthopedic nurse navigator will ask you about your discharge plan. A discharge plan helps to ensure a safe transition from the hospital to home. We use 2 main ways of gathering this information: a MyChart pre-op questionnaire or a phone call. To cut down on pre-op phone calls, we send out a pre-op questionnaire through MyChart 2 to 4 weeks before surgery. This questionnaire asks several questions to build your discharge plan. The questionnaires are reviewed by the orthopedic nurse navigation team. If any further questions are required, you may receive a follow-up message in MyChart or a phone call. If you cannot access MyChart, you will receive a pre-op phone call approximately 2 to 4 weeks before surgery. Please call Megan Doman if you have any questions following this presentation. April Matthews will see you at the hospital and help coordinate any discharge needs during your stay. Thank you for choosing Piedmont of Augusta. We look forward to serving you.